Now we're going to talk about the lymphatic system. If you recall when we talked about capillaries, we said that they leak about 20 liters of fluid a day out into the tissues, and they then only recapture about 17 liters of that fluid. So that means then that the lymphatic system's job is to capture that other 3 liters of fluid and return it to the blood circulation again. So everywhere we have a capillary bed for blood vessels, we're going to have a lymphatic bed as well, and those vessels are going to be called lymphatic capillaries. If we look at a lymphatic capillary here, we can see how it would work. So let's say we've got fluid accumulating out here in the tissues, and this lymphatic capillary sitting here, and there are these little valves. So right here we have this little flap, this valve, and fluid will pass through that valve into the capillary when the pressure outside the lymphatic capillary is greater than the pressure inside. So as that fluid's building up in tissues, it's sort of oozing its way into the lymphatic capillary through that valve, and then it's going to pass up the lymphatic capillary to the rest of the lymphatic system. Once the fluid is inside, it's not going to come back out because, like all the other valves we've seen so far, these are one-way valves. So some things that are going to influence rate of fluid movement into the capillary. We've already said pressure. Also, movement of surrounding tissues will alter the pressure. So if you're more physically active, the muscles and the movement processes going on are going to squeeze more of that fluid into the lymph capillary, and then will help squeeze it along the capillary and move it on to the rest of the system. So being physically active is very helpful for lymphatic system function. And if you've been, let's say, standing on your feet for long periods of time on a hard floor, things like that, yes, you have blood accumulation in the lower extremities, but you also have this fluid buildup in the tissues as well. So if you're physically active, not only does it help to push the blood along through blood vessels, it helps to move the fluid into lymph capillaries and out of that part of the body as well. So being physically active is always a helpful thing for circulation of fluids throughout the body. Because the lymphatic fluid that's being picked up is not just limited to water, it can also include things like white blood cells, and it can include bacteria and other possible pathogens. So before we send that fluid back into the blood supply again, it needs to be filtered. And what you see here in this image are a couple of what we call lymph nodes scattered down the system here. And those nodes are going to filter that fluid before it goes back into circulation. Lymph nodes are scattered throughout the body, but you will find them in clusters within the body. So over here we have the arm. Here at the elbow is going to have a cluster of lymph nodes. Up here at the axillary or armpit region is a cluster of lymph nodes. Here in the neck is a pretty good sized cluster, and it runs up the side of the face on both sides. And we're going to have a really big cluster down here in the pelvic region. So those are the areas that we would expect to find most of the filtering going on, and where we would look to see if we have inflammation. So if lymph nodes are swollen, that probably means that there's an active infection going on, or an infection that was active a short period of time before, and they're swelling up with this accumulation of junk that they're filtering out. If we look inside a lymph node, we find reticular tissue. If you recall from chapter 4, there were a lot of different kinds of tissues, and one of those was reticular tissue. So it's basically forming this mesh or filtering web of tissue inside a lymph node. And we can see here it's capturing some white blood cells in the form of lymphocytes and macrophages. And they've probably been dealing with some sort of infection there. The reason you want to filter this fluid before you send it back to the blood is so that we don't turn a localized infection into a systemic infection. If you, let's say, cut your finger, there's going to be an inflammatory response. And that's a normal part of the immune system response and a normal part of tissue damage and repair. In this process, there's the potentiality of pathogens there, and the lymph capillaries would be just as likely to pick up that infection as anything else, and then possibly, again, turn it into a systemic problem. So running it through these filters first hopefully will keep that infection localized. If the doctor thinks you might have a particular infection or a particular problem somewhere, they will look at the lymph nodes to see if they're swollen. And if they're swollen, that means there's a problem in that area of the body. If the doctor finds or suspects cancer, they'll also check the lymph nodes. And if they find the cancer in the lymph nodes, that probably means that it's spreading. And the primary methodology of spread here might be it gets picked up by the lymphatic capillaries when it breaks free. And again, if it doesn't go through these filters first, cancer could quickly spread throughout the entire body. So they will look specifically at the lymph nodes closest to the area of problem or the suspected area of problem, and that will then tell them with a reasonable likelihood whether or not that cancer is spreading. So if they find cancer in the lymph nodes, that says it's moving, and they'll keep moving out from there until they no longer find it. If we look at primary and secondary lymphoid organs, we're looking at some that have some degree of filtering functionality, just like we saw with the lymph nodes, and some other functionalities as well. So if we look at the appendix, I'm not really sure that calling the appendix a lymph organ is really an accurate description, because it doesn't have much in the way of filtering functionalities or any other significant contributor to the immune function. So I'm not really sure about that one. Peyer's patches are going to be the lymphatic system of the small intestines. The spleen is going to be a really big filtering unit for the central part of the body. Tonsils, as you would know, tonsils in your throat become swollen with throat area infections, and they're perhaps the most famous of the lymph nodes because everybody knows about the idea of swollen tonsils. The thymus is going to be involved in teaching the immune system cells what to do and how to do it, and bone marrow is going to be where those cells are made. If we look inside a lymph node from its general anatomical characteristics here, we find that it looks much like a kidney, and it works much like a kidney works. In the case of a kidney, we have blood come in at high pressure, go through those filtering units, and then come back out cleaned at a lower pressure. And the same basic idea happens here with lymphatic nodes. The differential here is that in kidneys we would have blood come in right here in the center, and it would come out right here at the center as well. With lymph nodes, we have the fluid coming in from all around the edges rather than a centralized location in the middle. But otherwise, the internal structures look remarkably similar. So we have filtering areas out here on the edges, and then it dumps that hopefully nice and clean fluid in here to the middle, and where it will then flow out through these efferent or outgoing lymphatic vessels. Those vessels will plug back into the circulatory system and put that clean fluid back into the blood supply again. Once we get to the idea of kidneys, you'll remark perhaps at how similar these two functions look and work. In both cases, the point is to filter fluid and make it clean on the outgoing vessel, and both of them are working on a pressure-driven system. And just anatomically, they look very similar as well. If we look in the spleen, in the bottom right, so picture D here, we would find these areas of filtration a little bit more clumped, and it looks a little different on the inside than a standard lymph node would, but it's doing much the same thing. One note on the spleen is that if you have a significant infection, and especially chronic infections will show up as swelling of the spleen. And if you have those sorts of things, mono, for example, would be an example of more of a chronic infection for a little while. The spleen often becomes enlarged, just like the lymph nodes in the tonsils could become swollen. And so the doctor might then suggest that you minimize how much weight you pick up and move around, because if you put too much pressure on a swollen spleen, it can rupture. As you see here, it is very heavily vascularized, So if this highly vascularized and very swollen at that point tissue ruptures, then you're going to have massive amounts of bleeding. So that's a thought to keep track of and be aware of, that inflamed, swollen spleen means a physical activity reduction is a good idea. If we look inside tonsils, they have this sort of structure here, a little bit of a filtering and some tubing running through to take the fluid through, be filtered, and then remove it as you go. Here are the Peyer's patches in the small intestines. So what we see here is the lumen of the intestine where the food and such will be passing through. Then we're going to have lots of these Peyer's patches here, and then muscle. And in this case, the Peyer's patches are looking at reabsorbing fluid, but they're also looking at absorbing nutrients. Because they're specialized as absorbers, and the primary function of the small intestines is to complete digestion and absorb nutrients, being an absorption specialist is quite useful for absorbing nutrients from the system. Hopefully this was a very informative, albeit brief discussion, but really the lymphatic system is a pick up fluid, filter it, put it back into the blood again after it's cleaned, and that's all a pressure-driven system. See you next time, and have a good day.